Hello everyone, this is Dr. Air and today I'll be talking about meth psychosis. Sadly, I'm still seeing a lot of patients who are struggling with the negative ramifications of using meth. I recently saw a 22-year-old straight-A student who got introduced to meth by some friends, got addicted really quickly, stopped sleeping, became psychotic, and he was hearing and seeing things. He had his phone ringing all the time and became very paranoid, felt someone had put a bug in his house and people were spying on him. He locked his doors and windows and put plastic bags over his windows as well. He stopped taking his phone calls as he was worried about the waves from the phone interfering with his brain. And his mom eventually called the police and we ended up treating him, and he's doing a lot better now. So what is meth psychosis? According to the DSM-5, the correct terminology is methamphetamine-induced psychotic disorder. And psychosis is a mental condition in which an individual's thoughts and emotions become very impaired. It could present as hallucinations or delusions or a combination of both. Now, hallucinations are sensory experiences that appear real but are created by your mind. It could present as seeing things that are not there, hearing things that are not present, or a sensation of bugs crawling all over your skin, which is quite common with cocaine addiction as well. It could also present as smelling or even tasting things that are not present. Now, for some people, these experiences can be very frightening and distressing. Delusions are false beliefs that conflict with reality. And these symptoms can be found in other mental illnesses like depression and bipolar disorder and schizophrenia. I was looking at a study recently that showed that about 40% of people who use meth end up developing meth psychosis. Now, the good thing though is that there is treatment, and it's very important to consider treatment from a comprehensive biopsychosocial approach. Of course, the very first step is to stop using meth. And what we see very commonly is for those who stop using meth, the symptoms tend to be transient, which means they go away within a few days to a week after you stop using meth. Now, in some cases, however, they could persist for months and even years. Now, when we have to use medications, we consider medications like antipsychotics. Examples of these are risperidone, paliperidone, quetiapine, olanzapine. And the idea is to use these medications to curb the symptoms, the hallucinations, and the delusions. Now, in some cases, some people might present with a lot of agitation and a lot of irritability as a result of the meth psychosis. And in cases like this, we use another group of medications known as the benzodiazepines, and that's just to curb the irritation and the agitation. Examples of benzodiazepines which we use are clonopine and lorazepam. It's very important to consider the psychosocial component of treatment as well, because psychological factors and social environments can play a huge role in your physical and mental well-being. Now, after the initial stabilization of the acute phase of the meth psychosis, it's important to treat the meth addiction proper. And the reason why this is really important is because you want to get to the root cause of your meth addiction. Why is it exactly that you're addicted to meth, and how can that be resolved? So meth addiction can be inpatient or outpatient. Now, the inpatient treatment is usually done in facilities known as residential treatment facilities, which a lot of people commonly call rehabs, where you actually go over to the facility and you're there for 30 days, 45 days, 60 days, 90 days in some cases to get treatment. It can also be done outpatient, which might be an outpatient clinic with an addiction specialist. It could also be a higher level of care than this, which will be an intensive outpatient program. There's also the partial hospitalization programs as well. These are all outpatient treatments. Now, unfortunately, there are no medications that actually help with meth addiction, just like with alcohol and opioids, but behavioral therapies are very helpful for meth addiction. It's also very important to treat co-occurring disorders, because we very commonly see a lot of people self-medicate their ADHD and depression and PTSD and schizophrenia with drugs. So if the co-occurring disorder, the mental illness, is treated, we see a lot of people just do so much better in terms of living a better life in recovery and being able to stay off of meth and other illicit substances. So for more questions and answers on addiction, please subscribe to my YouTube channel, and I will speak to you soon.